Hi, Amy. Nice to meet you in person.
Thank you. I think it's great to meet you as well. Thank you so much for coming today.
Yeah, absolutely.
Really good to be part of the conversation. Really to think about things that we can do together.
Yeah. No, this is great. Appreciate it.
Mm.
Already got a list of follow-ups I got to do.
Nice. Nice. No, that works. Yeah, I do too. Okay, don't need microphones. Arun, are you able to hear us okay?
Yeah. Are you able to hear me okay, Amy?
Yes, sir. Loud and clear. Thank you.
Yeah, sorry, couldn't come in person today. I was hoping to meet you in person, but couldn't, but some other time.
I know, that would have been fun. Plus, so we had an array of different goodies for breakfast and these little filled donut holes that I typically don't have. Oh my God, they're so good. I just had one.
Yes.
Very dangerous. Probably good I'm not in that room again.
Donuts are very, very addictive. Like, especially when it is right there, very accessible. It's like very.
Dangerous stuff. So you are missing very good donut holes around.
Oh, I'm good from that point. I'm good there.
I can't remember the last time that I actually had a donut hole. It was very atypical, but I'm like, you know what? Those look good. So
do they have good coffee? Because donuts don't attract me, but good coffee does.
we do have coffee and we have Arnold Palmer's too, which somebody got all excited and said, oh, it's like happy hour. I'm like, no, there's no alcohol. No alcohol. But yes, lots of good stuff. And
They
Kat
always
did a
have
very
great
good.
food.
What's that?
They always have great food.
Thank you. Yes. Oops. Let me see. All right, Mimi, so you're gonna come in and help us out?
Is this the room you need help in?
Yeah. Oh, yes, please.
Okay, so
I am.
let me grab some things on my way back, yes.
Yes, please. Gonna rejoin by Zoom. Hey there.
Hey.
So, I just need to join. So I just need to join the breakout room from on my laptop so I can see the chat, right?
Yes, I can pull it up here.
Oh, okay. Whoops, I'm joining without video
It's easy for it to.
and without that. Just want to see. I'm not seeing the breakout rooms on here.
You go to more.
I have to go to more. Okay. Join breakout room. Okay. And where am I? Communication.
The bottom one.
Left. You. So. Over that. Got it.
Thank you.
Okay. And yeah, I'm all set.
So
Thank you. All right, let's see, 12:04. Folks, just, is everyone out of Sora, do you think, or?
I don't think so. I think
No, okay.
yeah, I saw people in the hallway.
Okay, great. Hey, Miriam. Hey, Arun. I know it's a little bit after, we're starting a few minutes late. We're gonna give folks just another minute or two. I think they're still finding their way from the Sora room to the breakout rooms. But if you need anything, please feel free, unmute, jump into the chat, whatever works for you.
Sounds good.
Awesome, thank you.
You could take a peek where everyone's.
Yeah, can we make those?
Well, I'll zoom in for you. Is that
Okay,
what you like?
perfect.
Yeah.
Yeah.
Which one? We're gonna start at the top left?
Yes, please. Oh, yes, it needs to be bigger.
Like
That's better. Okay.
this?
Yep.
Okay.
Thank you, ma'am.
All right, be right back.
Perfect, thanks.
Did I understand correctly if the second session is also also the same topics?
Yes.
Okay, perfect.
Yes, definitely. Well, start the second sessions, I think by reviewing what was discussed in the first, seeing if we want to add anything to it.
Gotcha.
And then carrying the conversation further. Perfect. Yes, thank you. And then we're recording them too, so people can always catch up later if they have multiple interests.
I have to leave around 2, but that should give me
Me too.
both. Like that'll give me still the majority of both
Yeah.
sessions. So.
That'll work out well.
Okay, it looks like we are good to get started, Amy.
Excellent, thank you. So Arun and Miriam, and we don't need microphones in the room because the microphones and speakers are in the ceiling. So we're all set there. So we don't have to remember to
Like,
to activate the microphone or anything. Why don't we do a quick round of introductions, just so we have an idea of kind of who's in the room. Really appreciate everyone joining us. The purpose of this session is to talk about the communication platform that's being developed and really want just more ideas from folks, and particularly we're looking for additional partners. Can I start with you with your name and
Sure,
affiliation,
sure.
please?
Thank you. Good afternoon. That was a good lunch.
Thank you.
Yeah, Walt Jones. I work at the place where we're a human service provider for people with developmental, intellectual disability population of northern Arizona, predominantly the Navajo Nation. So yeah, I just want to learn more about how the platform is, the communication. So that's where I'm coming from, and to see what we can network regarding delivering human services in a poor system that we have, the IT. So somebody mentioned something about the broadband. So I'm interested in how we can stimulate our connectivity to resources like yours. And so that's what I'm.
Perfect. Thank you. Thanks.
thanks, Walt.
Oh, hello, everyone. Human Services Administrative Assistant Mimi Bustila here for your technical support.
Thank you. Amy St. Peter with Meg.
I'm Vince Torres. I'm with Unite Us.
Genesis Verdusco with Equality Health.
Excellent, thank you. And it just serendipitously happened that we have transportation, healthcare, and tech all right in the room. And online we have Arun. Would you want to introduce yourself, please?
Sure, thank you, Amy. My name is Arun Arunachalam. Nice to meet everybody. I work at the ASU Cloud Innovation Center and had the wonderful opportunity to work with Amy and team on a prototype trying to solve this communication problem between the healthcare provider and the transportation service provider and our elderly citizens who all need to be in the loop as the medical appointments are made and changes are made. So we'll be very happy to share my thoughts and hear from you as well on that topic. Thank you, Amy and team.
Wonderful, thank you so much. And Miriam.
My name is Miriam Margulis. I am with NAU AmeriCorps Seniors, and I'm just here to see how we can help and see where we fit in the equation.
Wonderful, thank you very much. And you've put your hair up since the earlier session.
I'm just not feeling all that great. So I'm just like, I don't know what to do.
I know that looks great. And I think you mentioned that your family has COVID. So I hope that you all heal really quickly and well.
Oh, thank you.
So I know that's tough.
Thank
We
you.
keep on thinking, oh, it's over. No, it's not.
No, I managed to go the whole pandemic without catching it.
Oh my gosh.
And then now that we thought it was over, the baby got it, I got it, now my daughter has it.
Oh, ouch. Okay, well, hopefully all of you heal really well.
Thank you, appreciate that.
Absolutely. All right. So we have kind of a process to help us consider different angles of this project. And we have been working on this for a while, but there's still opportunity there that I'm not sure that we've really tapped into. And so it really does help to speak with new partners about this, to kind of figure out what are we not thinking about yet, and what would be helpful in this space. Anything from additional partners, additional functionality, maybe a new way or different way of working together. So I really look forward to the conversation today. In terms of our first statement, then we're looking at framing this in terms of a problem and opportunity statement with the purpose of just making sure that we're all really clear on what exactly are we addressing, because there's any number of different things that can and need to be addressed. And we're zeroing in on one particular component of that. So I can share with you the way that we've framed this so far, and appreciate you helping to refine this to further help us understand all of the elements of this problem and opportunity. So in terms of what we have so far, and Mimi will be updating those little post-it notes. When we thought that we'd be all in person, we thought, okay, we'll have flip charts and post-it notes, and because we're hybrid, which is great. I think that's exactly the way to go. We decided to do it this way so everyone can interact on kind of an even level there. So Mimi will be able to add the post-it notes for us, whether you're in person or online. So in terms of the current problem opportunity statement, I think we could frame it roughly as, because of missed healthcare appointments, we have an opportunity to streamline communication with among healthcare providers, transportation providers, and the older adults being served. Would you phrase that differently? Do you have any amendments to that? Are there other things that we should be considering?
I don't know, I guess I pose this to the group is, do we need to target so specifically on older adults?
We do not.
Okay.
It could be broader than that.
Yeah.
Yeah,
I think transportation impacts all levels.
absolutely. No, thank you. That's a great amendment to it. So because of misappointments, we have an opportunity to streamline communication among healthcare providers, transportation providers, and just patients.
Yep.
So patients of all ages. Okay. Perfect. Thank you. And thank
Sorry, one more time, streamline.
streamline communication among healthcare, transportation, and patients.
Okay, thank you.
It'd be healthcare, transportation, and patients.
Amy, can we say that anybody who would require transportation help, and that's the audience we are trying to target, right? Even though we're getting a little broader from being senior citizens, a little bigger population, but at the end of the day, all of them would, in some way or shape or fashion, require some sort of a transportation service to help them out. Is that true?
Yes. Right. So you're saying that because of misappointments, that this project is more specifically looking at people who do need transportation assistance.
Yeah, the reason I'm thinking is, let's say my son needs help to go to the doctor, right? I'll pick the car and take him. It doesn't include, and I don't require that service to be served to somebody else. So I want to qualify. That's the part I was trying to get at, qualifying that's
Yes.
the population we are looking for, right?
No, thank you. So tell me if this is correct. What you're suggesting is to add in patients who need transportation assistance.
Hmm.
Is that correct? Okay. So
Patients
who need transportation assistance or who need rides.
Okay.
Perfect. Excellent. No, thank you. And that's exactly why we're starting with this, just to make sure that we understand it the same way. Okay. Whoops. Okay, there we go. And it's back. Any other changes to our problem opportunity statement? Okay, excellent. Mimi, can you take us to the next one? So this is, so the next phase, the next set of questions is really looking at project duplication, because we understand that there are a lot of good efforts underway, a lot of really good people doing some great work in this space. We want to make sure that one, we're not duplicating them, and two, if our interests and priorities align, that then we're working with them. So is there anyone else or who else would be providing services in this area already?
So it's my understanding that our state Medicaid agency Access is providing transportation at some level.
Yes.
So I would just say, I don't know what that level is, and I'm not 100% certain, but I know that they are doing that. So it's just an area of overlap.
Yes, absolutely.
We also provide transportation, but we provide transportation and companionship at the same time. So we would provide transportation to either a medical appointment and or social appointment. And we stay with them throughout the process. So we don't drop them off. We're there.
That's perfect.
Yeah. So depending on the need, we stay with them throughout the entire time that they're there at their appointment, and we provide that like emotional support as well. But one thing I don't know where it would fit is sometimes we and I put NAU AmeriCorps, that way we know it's through them, but sometimes we have clients who would like to take along their daughter or their significant other, like the husband or the wife, whatever. And that's where it gets kind of tricky for us because of the liability factor. So I don't know if anybody has taken that into account on any of these charts, is what to do when a client would like to bring someone that would be maybe a caregiver of sorts. Usually they have to, provide their own transportation to get there, meet us at the appointment. But that hasn't been something that I've seen a company do, like whether it be Phoenix Transit or the Dial-A-Ride people. Like you can't have anybody else with you, basically.
No, thanks, Miriam.
Yeah.
No,
And that's a need.
It is a need. Absolutely. I have seen some agencies do that. I know as part of our rural transportation incubator, we would see that come back in the reporting because the purpose of that program was specific to older adults. But then when they would report the ages of people transported, they had some folks who were not older adults, but it's because they were companions to the older adult being served. So that is being done, but I think probably on a more limited basis, and something that would need to be addressed. And there's certainly a number of really good agencies providing healthcare, providing rides already. Is there anyone else more specifically focused on enhancing communication among transportation providers and healthcare providers? Is there anybody else in that space?
This is just a question. Are any of the ride sharing organizations doing anything in this capacity?
Not on a broad scale. I know in Maricopa County, specific, I think still to the East Valley, maybe some in Central Phoenix. They are doing that in partnership. Sometimes the smaller communities will contract.
Okay. And I don't know, that's why because I know that there have been instances where I've heard of ride sharing orgs, like Uber, or Lyft, or what have you, doing some level of this, but I think it's intermittent.
It is intermittent and they don't do it all the time. It's by referral, and sometimes they get that fee covered. For example, I know my father-in-law sometimes will take an Uber going from medical appointments, and it's covered through either his insurance or something. He doesn't outright pay for it, right? Through IORA. So like IORA uses Uber, things like that. So it is getting done. And then you saw more of it when the pandemic came, you know, on the scene, as they were providing free rides for seniors to get to and from vaccinations, if they had some kind of relationship with the YMCA and things like that. Again, it is definitely limited to particular agencies.
Miriam, could I ask you a quick question on that use case? So in this case, your father-in-law himself takes on the responsibility of calling the Uber, coordinating with the healthcare, and taking care of all his needs, or is somebody else coordinating that for him?
IORA takes care of all of it for him, so he doesn't have to worry about the app or anything like that. They just let him know, hey, your appointment's on this day, your car will be there at this time.
I see. So
Someone will be picking you up.
medical appointment wherever to change, they would be involved in notifying him and taking care of Uber and all of that.
They take care of all of it for him, yes.
Okay.
Which makes it even easier on him as a senior, because then he doesn't have to, you know, remember or any of that. And they send him reminders, which is nice.
Right. Yeah, no, absolutely. And so this, I think, is particularly helpful because then we're identifying potential partners to this, as well as other models to take a look at and figure out if they're doing something that we can also be doing.
I know for us, because we work with different health plans, when they're tasked with, when one of our members has a specific, depending on, of course, their health plans, if they're tasked with a community health worker or one of our care specialists, that they help coordinate that appointment with their PCP or wherever they're going. Our CHWs, our care specialists, will book that appointment. And then when it's time for them to go home, they just tell the receptionist, I'm ready. And then they will make sure that they get their ride back.
Okay.
So similar to what Miriam said, that's how it works on our end.
Excellent.
And it's through rideshare.
It is through rideshare. Okay, perfect. Thank you. No, it sounds really good. So it sounds like rideshare, at least in some situations, they've got a good process in place. And then maybe where this project could come in is to learn from what rideshare is already doing, and then to be able to engage more nonprofit partners in this space too.
So we were actually looking into Lyft Healthcare. We haven't gotten anywhere, you know, concrete, but from my understanding, it's just you pretty much pay there is no other fee to having the service. You just pay whatever that ride will be, and there's no upcharge onto, you know, we are, because we have that partnership, we're going to take a share or whatever. It's just whatever that fee is, doesn't matter if it's through healthcare or, you know, just you're on your own. There are no other fees. You just get access to that survey and that, I mean, to that service, and that's how it works. So
excellent. No, it's really good to know. Thank you. It's a great resource.
At least with the Lyft.
Okay.
That's what I've looked into Lyft.
Well, I've heard that Lyft, at least one perspective is that Lyft is more socially minded than some of the other ride sharing companies. So they tend to do more in that space from what I've heard. Okay, no, that's really good to know. Thank you.
And the only other thing, generic is philanthropic organizations, and this would take more research. I feel like there's a lot of philanthropic orgs like Virginia Piper and whatnot that might be allocating a lot of funding towards transportation. Again, intermittent, it's, short term. But that's the only thing I would just say is if there's any philanthropic support out there and what that might look like.
That's a great idea.
ACS has for specifically for cancer patients, they do have their transportation. And that's run on volunteers only.
Okay.
So I know they have some in Phoenix and maybe some in rural parts of Arizona, but,
Okay.
and that's nationwide.
Okay. Perfect. No, that sounds good.
But that one's just for their, for their treatment, not for diagnostic
Okay.
screening.
Okay. Good to
So the
know.
person has to be diagnosed.
Okay. Good, thank you. Any other related efforts that we should have on our radar?
Well, Elaine.
Yes.
Elaine.
Yes.
Yes, true.
He's doing great work there.
Oops, sorry.
And I do want to say that like on ours are all volunteer driven, so they drive their own vehicles.
Mhm.
We don't have like a stock yard full of vehicles that we use. We don't have buses or anything like that. So the volunteers use their own vehicles.
Right. Excellent. Okay. That's good to know. Thank you.
Mhm.
Okay, right. And then there's a number of nonprofits who do that as well. Verde Valley Caregivers and others. So, okay.
Did you all want me to write something down about Elaine?
Yes, that'd be great.
Just that they participate in this? Yes.
They
Yes, if they provide the
transportation
services.
Okay.
Yeah, they provide transportation.
Hey, Amy, can I ask you a quick question here?
Yes, please.
So now I think in this exercise, you started with explaining that we're going to identify duplicate projects that are going on here, right? So I think these are very good discussions. We are able to identify different stakeholders providing the surveys as such different shapes and forms and factors or whatnot. But should we also from a duplicate project standpoint, I think you kind of pointed out we are focusing on the communication angle of it, right? So should we be looking at how is communication being handled in these cases, and could this all be use cases for what we are trying to do here, more along those lines, Amy?
Yeah, absolutely. I think that sounds really good. Yes, thank you, Arun. So in terms of the communication then, it sounds like some of the agencies who are doing this already probably have their own internal systems. Is that right?
Or it's a specific coordination with a vendor or partner.
We typically go through our agencies that we partner with. And then they let us know that they have a new client or a client that needs assistance. We put together what we call a care plan.
Okay.
And we go that route. And then we work directly with the actual client once they've been referred to us.
Okay. Is there anyone doing this across vendors and across partners? Because it sounds like the systems that are in place are serving.
Yeah, I don't think it's a complex system. Does that make sense?
Right, yeah.
It's very specific to
Right.
oh, I know Joe over here does transportation in this local area
Right.
for these providers,
Exactly.
and that's it.
Exactly.
So it's not the intersectionality is not there.
Okay, which is good. I mean, that validates kind of the purpose of this. So, okay. Excellent. Thank you. Anything else on this question? Anything else to add? Why don't we move over to the next one? And that is, what does this project look for patients, transportation providers, medical providers, SEC providers, and funders? So do you have thoughts for how each of those different groups would engage with this? So what does the project look like? So for example, for the patients, if we're successful in this work, then it means that they will have better access to rides and to healthcare because that communication has been enhanced. Other thoughts for what this might look like for the transportation agency, the healthcare agency, funders, tech? So for example, Vin, so if we're working together, what would this look like conceivably for Unite Us then?
So this would, I'm thinking more logistically. This would look like a manner of building a network of transportation partners, but also education awareness for providers at all levels.
Yes. Yes,
So
good point.
there, to me, it's pronged. And so, we would have to educate each provider in our network that these are your transportation hubs and these are your go-tos that you have access to. And the platform will break it down into a geographical area. So I'm looking at it more of a practice transformation.
Excellent. Thank you. That's very helpful.
I think where I have the most, it's where I struggle is we just talked about where the duplication is.
Yep.
But then it's all of these programs serve different target populations, and that's where it comes hard. And yes, excuse me, there's, the Unite Us platform. But when you're searching for transportation, then you have to go through and see if they're actually eligible one by one. So then it's like a workflow thing. Then that becomes because you're trying to help this individual. If you're a provider, you only have 15 minutes, or is it who is going, obviously the provider's not going to do it, but the MA or the PA that's, following up, then, then people get backed up. And so that's my thing. It's like,
That's a good question.
I see where and I mentioned ACS, it's like, it's only for cancer, and like having to go through that, that's where my mind's like, how can we find an easier process that won't take much time?
Right.
The platform is awesome. It's just finding the capacity, finding the people to actually do it, or would there be a process of actual patients can also?
So the patient lens will come. We're working on the providers now, but to your point, the platform would take out all that administrative time. It already will say, these are the ones that are taking referrals, that will accept rides.
Yes.
That will transfer your patients. This is what you have in your area, in this vicinity. You can expand it we're building the network, so that's on us. But I think those are all considerations that that's why I'm looking at logistically. This is a practice transformation, but also a network building phase. So, but we want to pull out all that administrative work on the provider. They don't have time.
And that's why, like, if they have, like we talked about, if it's a specific, if it's the insurance, that's the one that's covering the ride, it'd be amazing if the technology piece, because you are able to put in their health insurance in there, automatically say, this CBO or this provider, with this patient, the system already reads, it's like, oh, they have Humana, let's say they have Humana, they have this plan, they're automatic, it'll only show automatically what they're eligible for.
It sounds like that's what it does though.
Yeah, it
filtered
does.
search.
It does, but it's sequentially, to her point. That's why I was going with education. We have to train, and there's also staff turnover. So that we built in weekly, monthly training sessions on the platform.
So it's sounding like it's a filtered search, but it doesn't get down to eligibility. Is that correct?
It gets all the way down there, but
Okay.
I don't want to say the problem. We're new in Arizona. The launch is newer. So like, let's say La Paz Mojave, that might be tricky. That's tricky. So we in Arizona, my team, we're bringing on all of the organizations.
Okay.
It's just a phased approach. We just started this year.
Right.
Yeah. So
Absolutely. Okay.
it's a matter of ramping to scale.
So you need to build up your network so that when people conduct the search, they actually have
someone to go to.
entities that they can contact. Okay. But to your point, you don't want to get a big list and then have to call each one and figure out, are they eligible?
Yes, and as they say, it's only as good as the information you input. So if you have community partners or providers that aren't putting in the information in the system, then if you only have first name, last name, date of birth, then if it does filter down, it will go just give you a broad. So,
and what you're speaking of is the quality assurance piece of it.
Yes.
So are all of these providers that we're onboarding, are they using it properly?
Yes.
Are they filling in all the fields?
Back to the education and training.
Okay.
Too.
No, that's super helpful. Thank you. So So that's what you're talking about, where you have to build up the network, but then you have to build up the training. So one, people put in the correct, adequate, comprehensive information, and then two, people know how to use it on the other end.
And what I would say is, this is already happening in 44 other states. So
Wow.
like,
Okay.
and they're at far greater, they're way down the road than us. So it's a proven system. It's just, we're replicating it, and it just getting to scale will take a little bit of time.
Absolutely. But some of the supports could be that training.
Yeah.
To help the assistants with building up the network.
Right.
And then just making sure that that search function is giving the information that people need. And
Because what we want to do is take it, all of this, that burden out of, for sure, out of the family unit, they're on their shoulders, but also for the providers and the network.
Absolutely. No, that sounds really.
They can actually spend time on the services rather than the administration.
Yeah, absolutely. No, that's a great point. That is really good. Okay.
You know, if I can just make a comment,
Please.
with our, as human service provider, we contract with Department of Economic Security. Soon it will be under access. So we contract with DES that we will provide human services either on campus at group homes or else in home care. So the state of Arizona certifies us, and there is eligibility involved in the Arizona long-term care, that to make sure that at least one or two of these, just like for instance, mental retardation, epilepsy, cerebral palsy, and autism. You know, those were the qualifications that certifies access. So that way, through case management and support services, we get the referrals through them. So we are a provider, and then like, okay, hey, where is Chinle Valley School? I see that they are providing services that in-home care, like respite, rehabilitation, and the other services. So that's where we come in. So as far as healthcare, and a lot of times they go by person-centered planning. So there's a team involved in how the case plan is made, how the service is going to be delivered, either in the home or else at the program setting. That's where I'm coming from. So it's quite interesting to learn more how the networking of the system goes.
Yeah, and you bring up a good point because of access, the MCOs or managed care organizations, but also tribal affairs. So IHS, how I think we need to tag that has a whole different operating system. And so I feel like transportation, I am not up to speed specifically, because I think it varies between the different tribal councils, but I could be wrong. But I think that's something to keep on our radar, because it's those are vulnerable populations that we need to be able to provide transportation. But I don't think it works the same as just access.
No, really good points. And just to pick up on what you had said, Walt, too, that what this looks like to the transportation provider is at least a few different things, right? One is that you're getting hopefully reimbursed for those rides, because if we, and that's a little bit of an aside, but back to the Z code conversation earlier, you know, so that if we do this really well and we bring it even further, it means that the transportation provider is getting reimbursed for the rides. It also means that your patient or your client is receiving more holistic services, because you're able to access that medical care for them a little bit more seamlessly. Yeah. Is there anything else from the transportation provider perspective? Any other impacts, any other ways that you would engage with this system?
You know, as I believe one of the young ladies there mentioned that we do provide that I mentioned in the introduction, that 5310 application we get from the state, that transfer we provide. So to our program, transport, the members, we call them members, they are members. So right services to either go out in social activities. So this is a middle-aged adult population. And we can serve state of Arizona, or predominantly is northeastern Arizona in Chinle. So pretty much we're centrally located up north.
Okay.
So we do other integrated services in the whole. So this where our transportation comes in to transport our members to and from either a home visit and things like that. But this is not, but we do contract with Access or division with transportation. So remember, the young lady that Delphine that was there, she's my business manager, and she's the one that we get a rate book that we go by at the level of care, and she books them, and that's how we pay for services.
Excellent. No, that sounds great. Thank you. Okay.
You know what? I'm gonna leave the group now, so.
Okay.
Thank you. This is quite interesting.
No, thank you very much. Really appreciate you being here.
Thank you so much.
Sharing that all. Okay. Excellent. So for the transportation provider, that they're getting reimbursed, that they're able to provide a broader array of services for their members. Healthcare, I'm not sure if you want to speak a little bit to that, what this looks like from a healthcare perspective, or?
Well, it's people getting access to care.
Yeah.
You know, improving access to
Yeah.
care, more specifically in the rural communities. And, you know, we've seen that even, you know, prior to COVID, there was that access to care just because, especially in the rural communities, because of the distance.
Mhm.
And then COVID, because people didn't want to go to their doctor's appointment. So now we see all these individuals who have their medical needs that haven't been addressed for X amount of years.
Right.
So now we're seeing people having those exacerbated, you know, medical conditions. So I see this as improving quality of care
Good.
all around. And then obviously, you know, it's the people, yes, but then you also see this on quality metrics as well. For, you know, our plans that we contract with as well. And then the providers, you know, being able, I see this as an opportunity to open the conversation on addressing SDOH.
Yes.
And that and have, you know, asking your patient why, like, instead of, you know, training our providers to, instead of being upset because someone was 15 minutes late or a half hour late, saying, are you having issues with transportation? Is there something we can help with? You know, so going back to that education and training and addressing why, or, you know, being able to be flexible if somebody for some reason turned out to be early, you know, switching that around and just being more flexible, because like I said, addressing those social determinants of health is also important too. And we need to shed a light on that and seeing what other needs are there.
Mm-hmm.
And it might not necessarily be, you know, yes, transportation is an issue, but there's more to that. Is it because they don't have a car? Is it because they just lost their job? You know, what other things can we address? So I think this opens a door to many other things that we can help focus in and help our community be healthier, not just physical and mentally, but, you know, within the community itself.
Perfect. That sounds great. Thank you. Thanks.
Amy, I think this is a very good point, right? This is exactly what we came across as well when we were doing our proof of concept. We started with solving the problem associated with medical appointments and schedule, but we figured there is much more bigger scope in here that we could easily accommodate as well. So this is very nice to hear that again here in this forum.
Wonderful. Thank you, Arun. Totally agree. It's very, very validating and very informative. Excellent. So we discussed the perspective of healthcare, transportation. I think for the patient as well, from the tech perspective. Okay, excellent. Anything else on what this looks like?
Possibly, you know, getting to one, when we talk about technology, everyone has their own thing that they work, you know, and some, you know, we've come across some of the organizations that and the duplicating are probably already doing one thing. So hopefully with this, it'll be like one-stop shop, if not just narrowing down some resources, which is helpful for our providers, for our CBOs that we work with. It's just, there are a lot of tools everywhere, but you know, we just want one centralized thing that we can go to that's effective and not as time consuming. So just narrowing down on our resources.
Yeah, that's perfect. Thank you. So being able to centralize some of the resources then and to make sure that it's even better information or resources than before. Perfect. Thank you. Can you put centralized? Thank you. Awesome. Excellent. Okay. Anything else on this question? Okay. And then the next one is looking at what resources can be offered and by whom. So that we're looking at knowledge and skills, existing tools, in kind, and then what what resources do we have that we need to include in future discussions? So we have transportation 5310, medical reimbursement, absolutely. What are the resources that could be brought to bear with this project? Any ideas there? Not that we're committing them, of course, but just could be one of the next steps to contact them and see.
Yeah, I mean, I feel like just in the obvious, kind of like Department of Transportation or, you know, our state agencies is an obvious one to me. I think that's something that we need to always kind of work in tandem with them, because I think that also drives policy.
Yeah. Absolutely. And particularly with wanting to reach a systems level, we really need to be engaging with our state agencies.
Yeah.
So state agencies for health, transportation.
Yep.
Other adults.
Would that include like the dial-a-ride programs and things like that?
We can include that, absolutely. That that's sometimes a state agency, that's sometimes more of a regional. But yes, we absolutely need to be including them.
And then, I mean, I would add ours, but we are under the 5310 transportation, so I think we'd be covered under that.
Oh, that's perfect. Thank you. Good. Any other, and everything about resources really broadly. So, I mean, it could be volunteers, it could be expertise. It could be a certain skill set or attribute. Anybody else who could positively contribute in this space?
I would say volunteers, since, you know, a lot of us do have volunteer drivers.
Yes. Absolutely. Yeah, that sounds good.
I think for knowledge and skills, even though we might have some opportunity and for transportation and rides and of that service kind, I feel like sometimes it's that knowledge and skills piece or the awareness of it. So I don't know if it's a matter of who do we get in front of within certain platforms or like coalitions over like corrections, right? Like people who are coming out of the justice system, like or getting back into civilian lifestyle. Like I don't know if that's more of a resource that we could leverage that within our collective wisdom once we get to that level.
Yeah.
Of like, now how do we let people know?
Yeah, no, I think that's a really good point, because I think so often we're so focused on developing whatever product it is, then we don't promote it.
Yeah.
And then we wonder, well, how come no one's using it? Well,
Right.
because we didn't get in front of them. So no, I think that's a really, really good point. What are the really good communication platforms or vehicles for that?
Well, I think Solari 211 is huge, but that's also embedded into the platform. But I would say that where is it that our heavy need is? So is it in corrections or the just like people that are coming back into work? Where are those at? And so are there coalition like the military families, like veterans, like are those like we just had the veteran symposium or the ACMF symposium, like having a space there or having a workshop or one of these breakouts. Those are the kind of things where it might just be getting the word out.
Yeah, and even with, we talked about the community health workers, the people that are actually in the community, the promotoras, in your FQHCs, we're just around the corner, back to school events, you know, making sure that information is readily available, because I don't go out in the community. But so if I'm attending these events and you're like, I'm in a coalition meeting, I'm not the one attending.
Right.
We want the boots on the ground people knowing about this. Because they're the ones that are actually interacting with our community members. That's why I say the promotoras, the CHWs.
And they have their own conferences.
Yes, ASCHO, yes.
Yeah.
Oh,
Yeah.
that's a good point.
Yeah.
Yes,
Yeah.
absolutely.
So
Okay.
getting in front of those individuals, I think, would be.
Yeah, having space in those types of spaces where you can like it's a sequential piece of it.
That's a really good point.
Or like usually like municipalities have their own coalitions, stuff like that. Like the back to school events, I participate in Glendale Family Strong Network. They put on events for the community and they work directly with the Glendale School District. So they can put out word, to all the make a flyer and they'll make sure that all their children in their district get those flyers. So making sure that you connect directly with the community, if it's a school, if it's a community center, the libraries, we were just talking about libraries, anywhere you.
Those are all trusted sources.
Mhm.
Yeah.
Yes, definitely. Absolutely. Libraries would be good too. Excellent. Okay. No, thank you for raising that point about promotion. It's really critical. That's all from everyone. Good. Anything else in terms of resources? Thinking about resources really broadly.
I would say it also starts at like the family service centers.
Mm-hmm.
Family service centers, letting them know the types of services that we have. So that those who come to them for other needs are able to get all of their needs met at once. Then like doctors' offices or medical facilities,
Yes.
working with the caseworkers at the medical facilities for that.
Perfect. Thank you.
Cities and towns, like, for example, I always get, I'm old school. I get my bills through paper. I don't do much email, but I always get my City of Phoenix water bill, and it comes with this little newsletter.
Yeah.
I always look at it because I want to know when the bulk trash is coming around. So even like your cities and towns, they're just making, because they have those newsletter distributions as
Right.
well, you know, that
Yeah.
people want to know about events, stuff like that.
Yeah,
So,
definitely.
yeah.
No, that's perfect. Yeah, and working with some of the smaller communities, I mean, that like the water bill, I mean,
Yeah.
that's their main form of communication with the residents, because that's one piece of mail that goes out to everybody.
Yeah.
Oh,
And
great.
that's done through the
Mail.
water department.
Yeah,
So,
yeah.
like, yeah, it's done through the water department. Sorry, I used to work for the city.
No, that's great. Thank you. Good information. Wonderful. All right, anything else on resources? Okay, then our last section, oh, not our last section, oops. Partner roles, responsibilities, and contact information. Now that we've talked quite a bit about potential partners in this, is there anything else that maybe we've missed?
I think this is tangential to some of the pieces that we mentioned, like with plans or some of the medical coordination, right? So Unite Us obviously would be part of the community cares
Yeah.
program, would obviously be a natural fit.
Definitely.
I'm thinking a little outside the box, and don't judge me, but but I think it would be an awesome endeavor to really reach out to the ride sharing organizations and look
Yes.
for
That's a great idea.
projects or programs that would be enticing for them
Mhm,
in this arena.
mhm.
Because I know you said lift healthcare.
Yeah.
So we need to look at that, what's working, what's not working, what are the challenges, and can we replicate it if it's actually having an effect?
Yeah,
No, I agree.
yeah, I think that sounds great. Absolutely. Okay.
And how can they partner with the small CBOs
Mm.
around? Because, you know, we don't want, I like that idea, but then I would hate to take away from the other organizations that are already embedded in the community and they're trusted sources. So how can they work with the CBOs already in the community that the community already trusts?
Right, well, and it could be a
And
way
business
of
there.
expanding capacity.
Yes.
Yeah.
Right, because I think a lot of agencies are just maxed out right now.
Right.
So we're talking about giving them more.
Yeah.
More people to serve.
Or going back to the reimbursement, making sure that
Yeah.
the actually volunteers, maybe they want to be part of Lyft. I
Right.
don't actually get reimbursed for their times.
So not necessarily supplanting, but supplementing.
Yes.
Yes, yeah, so I think we need to be really careful to keep our eye on.
And I think to your point, how can we look at what options do we have to incentivize? Like, it doesn't always, not necessarily monetary, although we can look at that, but what are other ways to incentivize this for partners?
Yeah. Yeah, absolutely. No, I think that's an important consideration. Absolutely. Good. Okay. Speaking of incentivizing, if we can go to the next section, and that's how is this paid for? So we've talked about reimbursements, like say from Access. Any other thoughts about how we could pay for this communication and coordination?
Is this a typo here?
I think it's either paid for or
Grants? Both.
It's both, yeah. No,
like slash from, maybe.
yeah, yeah, no, that's correct. Right, so we've talked a lot about how healthcare could help reimburse. Are there other revenue sources that we could tap into to help support this work?
Grants, fundraising.
Yeah, got grants, fundraising, the Medicare, Medicaid reimbursements.
Public donations
Mhm,
or seeking out sponsorships.
yeah,
Do we know if this is happening in other states, this level of work?
not that we've been able to find. Doesn't mean that it's not.
Right.
But we haven't been able to find it. 'Cause I know I'd love to learn from somebody if they are.
Can we use state dollars and federal dollars?
Well, because like first things first, and this is just kind of like, so it's a voter initiative, right?
Yeah.
That was the tobacco tax. And so
Right.
all of that money goes to early childhood. So I'm just wondering if there's ways to piggyback or look at that in a policy
Yeah,
lens
right.
around what is it that's occurring, like DUIs, I don't know, whatever is happening out there, and then some of the funding or whatever that's, I'm just.
Marijuana,
there
that's,
you go.
I don't remember what that's going towards.
That money's
but I
hard
know-
to touch, though.
Oh, okay,
Because it's very educated, they're going towards education.
Okay.
Yeah, like, don't do it,
But
which is ironic, right?
yeah, yeah.
Yeah.
But, I just wonder if there's some policy level considerations. I don't know what they would be, but
Oh, that's a good question. Are there considerations, other tax initiatives that we could piggyback?
or just nationwide, what other efforts?
Yeah.
I'm sure there's like a transportation, something nationwide.
Right.
That could help
Yeah.
point us in the right direction.
Uh-huh. Uh-huh. No, that sounds really good.
do we have connections with the Department of Transportation, like higher ups?
With ADOT, yes,
Okay.
yes, very much so. Good. Okay. Yeah, and I mean, I think ADOT would be a good.
Or just a soundboard of like, yeah.
ADOT access to look to the state agencies. So. No, that makes sense. Okay. Anything else on revenue sources? Then we have one more question to cover. Okay. Arun, Miriam, anything else on revenue sources?
No, I know we've been primarily focused on grants, at least for now, right, Amy? That, so I think you already have that covered here, so it's good.
Okay. Excellent.
We don't have reimbursement on there.
Oh, yeah.
Thank you.
Thank you. Yeah, we definitely need to add that. Okay, so we'll get reimbursements there. Perfect, thank you. Todd and I were talking over the break about the Healthcare Transportation Task Force being able to take on who else is working on Z codes and getting reimbursement for nonprofits. Because that seems like such a clear path. I mean, it's such a concrete step and.
Yeah, I was gonna ask about that because like we don't do any of that, being that we're federally funded, right? For our
Right.
stipend, and then we're locally funded by our 5310 for the mileage reimbursements and things like that for our volunteers. Like we've not tapped into that as of yet.
Mhm.
And we do deal with a lot of medical appointments. So whether it be cancer treatments, I'm so sorry, I'm like getting worse and worse by the minute. But
Oh,
the what do they go to? Dialysis? We take
yeah,
patients to dialysis, regular day-to-day appointments. And I know that each of those appointments codes are separate, right?
Yeah.
So, I mean, we haven't even tapped into that or even thought about, billing anybody because everything we do is at no cost
Mhm.
to the agency and or the clients themselves. So when you guys are asking me all these other sources, I'm like, all I know about are grants, fundraising and public relations and, just reaching, tapping into those and local agency partnerships to help cover the needs. But
Mhm.
outside of that, that's all I have.
Yeah, no, that's great. Thank you.
Amy,
All right, why Yeah, go ahead.
That just came to my mind is, as we were working through this, remember some healthcare organizations were interested in like adopting this and then maintaining it like as a single source. And there could be some stakeholder who's interested in doing this maybe and taking care of it. Is that a viable option as well? Like, in our case, we did have one example, right, where they said, oh, they might be able to adopt this and maybe for the greater good. I don't know whether that's an option.
So potential funder or donor, you mean?
Somebody who could, be the front runner basically, right?
Gotcha.
Takes this over and then says, let me take care of this, and then I can expand this to the broader community for using it, but they take care of everything from a day-to-day run basis, kind of, right?
Right. No, absolutely. No, that'd be great. And Arun, I think maybe part of what you're talking about too is we've really changed the way that we consider resources for this project, because initially it was more of a traditional funding model with, okay, we're going to go out and we'll get a grant and maybe from one or more foundations, and we'll implement the project on the basis of that grant. And then we started considering, well, are there other partners who could contribute? Like maybe just in-kind resources too. It doesn't have to be cash, it doesn't have to be a grant, it could be people contributing their expertise to the project, and no checks even have to be written. So I was looking for those resource partners and thinking about resources more broadly.
Exactly. I mean, you would end up with a bunch of these combinations of putting this together to make it happen at the end of the day, right? Yeah.
Right. Exactly. So it says in-kind contributions. Excellent. In-kind. Yep. Awesome. Thank you. All right. We have a few minutes left. So where are we starting from? First steps, next steps. What would you recommend? The first step is day 3. A conversation that, again, Todd and I had during the break too, was really want to position the third summit in the best way possible. So if that's continuing the conversations from this event, if that's breaking off into work groups and folks kind of working more independently and then coming together on day 3 to share. Would love to get your thoughts on what would be most useful, do you think, in furthering this conversation?
I think this is a good kind of gathering of information. What do we know? And kind of starting to lay out the methodical way to approach it. For me, I come from a little bit that sequential component is like what needs to happen first. So what you're trying to do here. But so is that more research like on going back through what we just discussed? We talked about other states or garnering more information. Are there ways that might seem like an easy one to kind of just, you said you've already done a lot of that, but is there anything we missed that we might want to kind of follow up on and then look at just going through this and tagging kind of phased approaches to it?
Right, absolutely. So the research to see who else is doing it, what kind of process did they do? Yeah.
But a lot of what we had, I think it's a good start and outline, but then starting to tag like, what is the first phase involved and what is the second? Yeah.
Right, absolutely. Well, I think the phasing on that will be really important too, because we can't do everything all at once.
Right.
And we need to generate attention, more energy versus.
Absolutely. Not putting the cart before the horse.
Yes, absolutely. That sounds good. And then we did talk too about having a demonstration phase, pilot project phase, and then full scale build out. So we have that in place as well.
And maybe identifying roles and responsibilities for us, like what can we do? Or like, it might help the collective understand, okay, what is my part in this? Because it's very broad.
Right.
Like, where do I need to focus my attention on?
Yes,
Yeah.
That sounds great. Yeah, I worked with a consultant years ago and he'd always get down to the belly buttons. Who are the who are the people? What belly button are you attaching to that particular action step? So we need to get down to that level too. Absolutely. Okay. That sounds really good. Anything else on this?
Amy, I think
just want to say 1 minute left on the time.
Thank you, Hezekias. Arun, the last minute is yours.
Sure, no problem. The best way is to actually do it, right? And then see in a very smaller scale, like we talked about. So that's, I don't know, it's the first step or the next step, but it has to be one of them to actually go experiment with a smaller group and learn from what's out there. That's what my 2 cents on that is.
Absolutely. No, it's perfect. Thank you. Just do it. Just do it, learn from it, refine it.
I think also it'd be like for the organizations that we mentioned that are not necessarily at the table, bringing them to the table so we can start those conversations and
Perfect.
saying. Because we can come up with all these great ideas, but they are the experts in that field and they can tell us, this is not gonna work, this is probably gonna work, you know, start figuring out and bringing those players to the table, I think would be helpful as a first step.
That's a great point. Thank you. Okay, anything else?
Sounds good.
Okay, it is 1 o'clock. It looks like we are now on break until 1:10. The other work groups will be meeting in Chaparral and Choya. So if you'd care to check those out, then that would be great. And then around 2:20, looks like we'll be gathering again in the SOAR room. Perfect for the final sessions.
So 2:20,
Thank you.
log in back again, Amy, 2:20, is that right? Or
2:20 for the final plenary, yes. We'll have another workshop like this one,
Okay.
starting at 1:10.
1:10?
Yes,
Okay, do I need to be in that one too, or can I come at 2:20, Amy?
you can come at 2:20. That's fine, Arun.
Okay, sounds good.
Thank you. Appreciate your time. It's so funny. It just made me think of my kids like, do I have to? Do I have to come to the 1:10 or can I just go to 2:20? But thank you both. That was really
Yeah.
helpful.
Thank you.
That's a good conversation.
That was really great.
Yes, thank you. Thank you very much. All right, and thank you for.
You're
taking notes.
welcome. It was harder than it looked, but.
Oh,
I know it's a lot
Capture
to,
everything.
lots of process there.
Kudos to you because I type like, no, probably the 1-year-old types better than I do. I'm like, so I wouldn't be able to keep up. I was in junior high and it had like a computer class and I didn't want to go to that school. We had just moved and I was being a rebel.
Oh,
And my thing was, I was usually good at school and I was like, I'm not gonna do well in that class. So I didn't take my typing class.
Yeah.
So now I'm,
Affecting you.
yeah,
But
so now I type like no offense to my dad, but like my dad. Now I type like my dad.
I know, I hear you. Same thing. High school, I didn't take typing and I'm still.
I'm like, I think I know my keyboard, but that was me trying to be a rebel because I was never the rule breaker. So it was like.
That's like your one
Too well in my
stand.
typing class.
That's funny.
And it bit me.
today.
So now, yeah,
Still,
so do well in school. That's
Yeah,
what think
I know,
children do
right?
in School, you never know when it'll come back.
that's awesome.
Bye.
I'm gonna grab some more water.
Okay, sounds
Before the next
good.
two come in.
All right.
Maybe have you tried those little donuts yet? The little.
With the chocolate in it? Yeah, that's pretty good. So you gonna go get another one?
I might.
Yeah, go for it.
I don't know.
Seemed like there was a lot of leftovers. Do you know, a new group's gonna come in and we're gonna start from scratch?
Yeah, well,
Okay.
no, we'll keep this and just walk through it and ask them if they
wanna
have
add
anything
to
to
it.
add. Yeah.
That makes sense. Okay.
Definitely.
Thank you for your help and patience with me.
No,
Whispering
no, that was
things.
great. No, it's hard. I mean,
It
it takes a lot of practice to,
Yeah,
you know.
I think it'd be easier if I knew maybe. what
Oh
they
my
were
gosh,
talking
yes, that
about.
makes a
Yeah.
big difference. No, it really does.
Yeah, the acronyms always get me, but
Oh, God, yeah.
thankfully they weren't too many, there weren't too many.
No, that was
acronyms.
good.
Yeah.
Hey.
All right, we'll go get your chocolate in your.
I know.
Was that you who jumped on? Or was that someone else?
So now you are good.
Okay, thank you. Appreciate it. Hello there. Hi, how are you? Good, good. Come on in. How's it going?
Does anybody know what that is?
Oh, the public art?
Is that what
That is called, I think it's She Who Has Patience. People have talked about how it looks like a cactus flower. It's really pretty when it's lit up at night. Because they have different, and then if there's a breeze, it kind of shimmers a little bit, so.
Cool.
Yeah, it was the subject of a lot of discussion, which is kind of the point of public art, so it achieved its purpose.
I was thinking it looks like one of those, I don't know, those spongy sort of things,
Mhm.
or, some sort of physical activity.
I know, yeah, lots of interpretations there.
Yeah.
Excellent.
You say she who has patience?
Yes. Yes.
Oh,
That's not what that spoke to me.
No, you'd be in good company there. Yes, yes, all right. Looks like we don't necessarily have anybody online, maybe quite yet, or maybe at all. So there we go. I know, poor Maria. She was such a trooper for
Yeah.
trying to watch. She good. Hey, how you doing? Come on in. If folks have not yet taken any of those little donuts, oh my gosh.
Oh, are they just chocolate in there?
Yeah.
Mm.
I was just thinking I need chocolate.
Time if you want to run and grab one.
It tastes like Nutella.
Yeah, I thought so
It
too.
does, yes, it's a good description.
Are so good.
You do need one, yes. Make sure you grab one.
This
Yes.
session.
And my kids would be, so I typically don't eat sweets, but I saw this, I'm like, okay, I could really use that right now. So I had one and I just had another one. It's very good. So excellent. All right. Well, thank you oh, there it goes again.
It'll just.
Thank
there we
you
go.
for joining us. Really thrilled to have you here. Look forward to your contributions at 2:20 back in the SOAR room where we were this morning. The purpose of this particular breakout session is to really start to kind of unpack, think through, uncover new perspectives on how do we improve and leverage, enhance the communication among transportation providers, healthcare providers, and then the patients who are being served. So we have a process it'll be the same process that you just worked through in the first workshop, but just on a different topic area, basically. And in the first workshop, we got some great feedback. So we'll be reviewing that as we work through each of these questions and really looking for any additional input that you might have. So is there anything that you'd like to offer a friendly amendment to? And don't worry, we'll be zooming in.
Yes.
Are there new ideas, kind of other thoughts, other questions, other considerations? So really look forward to your input. So the first one is a problem opportunity statement. And we have revised that a little bit to what we first had, but it's really looking at, because of misappointments, which is a problem. So we have an opportunity then to streamline that communication. And we did focus this more specifically on patients who need rides, acknowledging that a lot of patients have transportation. They don't need this. Great. A lot of patients can also track their appointments really well on their own. They probably don't need this either. This is more specific to patients, primarily older adults, but also other populations who need rides, principally because they're no longer driving themselves, and they might need some assistance with being able to track their medical appointments and making sure they have a ride to their medical appointment. Keeping in mind, as we discussed this morning, that right now, at least for some nonprofits, about 20% of appointments are missed because that appointment has already been canceled or rescheduled. And so then you have the volunteer driver showing up with the patient all ready for their appointment, and there is no appointment. And someone who lives relatively close to the healthcare provider, that might not be a big issue. In some areas, though, they could be driving an hour or 2 hours just to get to that appointment. So it's a big drain on resources, just energy for an already fragile population. So wanted to run that by you. Is there any other way that you'd communicate the problem and or the opportunity? Any amendments to that?
If I may.
Yes, please, Sam. Good to see you.
Good to see you. I'm trying to kind of phrase this exactly. I know there's been a lot of talk around a central referral platform, Unite Us, whatever that may turn out to be. I also just want to chime in from the transportation perspective. We really need to communicate around dispatching and getting like specific dispatch scheduling information. And one of the things I keep going back and forth on with Unite Us is whether or not their platform will have the ability to integrate with actual dispatching software. Because again, from a transportation perspective, that's the critical piece for us.
Yes, excellent. So to dispatch more efficiently and integrate with other systems. Okay, excellent. Thank you. Definitely. So same need or same problem statement, but the opportunity there really isn't just streamlining that communication, it's fully integrating that communication. Excellent. Yeah. Thank you. Very good, Sam. Thanks. Any other thoughts on that? Okay, excellent. So we're going to move on then to project duplication. We really want to make sure, because none of us have enough time or resources, right? There's just simply isn't enough time in the day. There's not enough money to go around. So if there are folks already working in this space, we want to, one, be able to learn from them, and then two, possibly be able to partner with them. And if there's something that somebody's doing that's just the absolute answer to it all, great, have at it. So we're also happy to step out of this space at some point if that's needed. So these were some of the ideas, and it's not necessarily, at least from what I understand from the first session, it's not necessarily that anyone is already taking care of this across vendors. That if they have some kind of communication in place among transportation providers and healthcare providers, it's within their own system, which is great. And that definitely meets the need of that one agency or that one system. It does not necessarily address the need across systems. And that could be across healthcare systems. It could be across transportation providers. So I'd love to get your thoughts on, is anyone else doing this? Keeping in mind that there are a number of partners engaged in both spaces. We have a number of very good transportation providers, number of really qualified healthcare providers, number of really great skilled technology partners or providers, but is anyone convening those three in this way across systems? Sam, do you want to jump in?
I'll chime in again. And really quickly, is it just 3 of us here? I can only see part of the room.
Yes, well, no, actually, thank you for prompting that question. We should do introductions. We do have folks who are outside the camera angle right now. So actually, why don't we pause? Sam, I'm so glad that you asked that. Why don't we pause and start with some introductions, just so at least Sam can know who's in the room, even if she can't see you right now. Janet, can we start with you?
Sure. Janet Major, and I work with the University of Arizona Telemedicine Program in Southwest Telehealth Resource Group.
Thank you.
And I'm Carrie Straub. I'm with the Yavapai County Free Library District.
Amy Bustila, MAG.
Amy St. Peter, MAG.
I'm Jane Lang, and I'm the founding director of the senior program at the State Health Department.
Thank you.
Eileen Talani from Assist to Independence to the City, Arizona.
Thank you. And Sam?
I'm Sam Johnson from Elaine Transportation, operations specialist at that nonprofit over there. And if I may, what I was going to quickly chime in is I don't see 211 up here. And I know they're also partnered with Unite Us, but one of the reasons I think we need to kind of get a clear idea of their role with Unite Us and how they might be able to help in the community is because they're so well known already. Everyone knows the phone number 211, and it's accessible to anyone with a phone, whether or not they're like technically savvy.
Right. No, absolutely. Yes, totally agree. I think that Solari and 211 are really good partners in this space. And they have a lot of expertise we can learn from them. So yes, thank you. Okay. So definitely have good partners in terms of community information and referral, technology, healthcare, transportation. Are there any other efforts that are combining all three of those? I think that 211 does a really good job of making information available to individuals, to agencies. Again, it's the intersection is very specific to that agency reaching out or to that individual reaching out. Is there anyone doing this across systems? Okay, excellent. Well, then we will endeavor to be the first.
I wonder if the Indian Health Service might fit into that description, because they often provide transportation down to Tucson for healthcare. And I'm not sure, how they actually coordinate that, but transportation is provided from Kansas City to Tucson, Arizona to see a cardiologist, for instance.
Right.
And I don't know if this would be more of the mission statement piece. But I think that, but ultimately the goal is to increase efficiency and prevent unnecessary travel.
Yes.
So maybe that should also be part of the mission statement, because all of the entities that are there and all of the challenges are appointments which have canceled, appointments that never happened. It's all about preventing unnecessary travel.
Yes, absolutely. No, that sounds really good. Thank you. Yes, so we definitely need to include that as our problem and opportunity statement, that one of those opportunities is to reduce the unnecessary travel. So I think that makes a lot of sense.
Yeah, increase efficiency and reduce unnecessary travel.
Absolutely.
Or the other way around.
Yeah, no, absolutely. That sounds really good. And interesting too that you bring up the Native nations, because that came up in our first workshop as well. That it is a very different system, it's parallel. But one where we'll need some really intentional focus to figure out how this works in that system too.
Right, there might be some valuable lessons learned there.
Yes. Yes, absolutely.
I'm not sure how that works either. I mean, our office is right by a hospital.
Yeah.
They're a contract hospital, so they're 638. They're not IHS. But we've gotten calls from folks who gotten stranded in Tucson, Phoenix.
Oh,
They
want to
were
get
brought
back home.
down, they've been brought down by the hospitals,
Oh,
but they
no.
weren't picked up.
Oh,
So-
gosh.
That, and it's really a problem.
And we've gotten a lot of calls
That's
from
horrible.
hospitals saying, can you guys come and pick him up and take him home?
Oh, you'll meet someone in Tucson who says, I just want to go home.
Exactly.
Oh,
So I
God.
don't know how that all
Me
works.
either.
Oh, no. Okay. Yeah, it's definitely something that we need to keep on our radar that it's the return trip, that we need to make sure that people have that return trip. Okay. Okay, no, that's important. Thank you. Oh God, my heart goes out to them. Well, it's a return trip, and then too, I've heard absolute horror stories about people kind of if it's not a seamless service, that they have to stop at a border and then be picked up by somebody else. People just being stranded in parking lots, metal wheelchairs, middle of the summer, just absolutely life threatening.
Oh,
Yeah. I know. All the more reason to do the important work that's underway. Okay. So anything else on others who are doing aspects of this work or running, or if they have work underway that's kind of parallel to this? Anybody else? This is also a really great spot to look for potential partners.
Another group is the area agencies on aging. They do a lot of work for the senior population, of course, but they coordinate with other service providers, and they're very knowledgeable of the other service providers.
Definitely. Thank you. That's really good.
I'm not sure what they're doing, but from what I understand, I know that there's great work being done by the Arizona Cooperative Extension offices, which are in each county. And I just learned at our last breakout that they actually also have included in their budget transportation. So it's worth looking them up because they are in every county.
Okay, that's Arizona Cooperative
Extension.
Extensions.
Okay.
Okay.
These agricultural free people.
Okay.
And it's on my list of URLs that I'm gonna send after
Yes,
today.
thank
It's like
you.
5 that I've already written down. Oh, don't forget.
Right. No, that's perfect. Thank you. Yeah. And there's a lot of information out there, and that can be the kind of the strength and the challenge of it, right? There's a lot, which is great, definitely resource, but then we need to be able to access it and share it and promote it.
And say something.
Yes.
Let me introduce myself first, tell you what we do.
Yes.
We're a center for independent living located in Tuba City, Arizona. That's on tribal land. Around us is, we're actually, I guess, on 3 tribal lands, Navajo, Hopi, and San Juan Southern Paiute. San Juan Southern Paiute does pretty good. They take care of their own folks, and a lot of things seem to be taken care of for them, with them and for them, I guess. And Hopi has a lot of transportation programs, so the transportation needs are pretty much met. And I think it helps that they're in villages and they don't have to go far, out to rural areas a whole lot. But Navajo is a different story. They're like spread out. We have a lot of needs, especially senior citizens. The tribe has never been great at helping senior citizens. And we're not sure where the monies go in terms of, I know there's an area on aging offices over there, but we're not even sure what they do, because we know they run the senior citizen centers, they feed the populations, they have Meals on Wheels, but that's about it. There's a whole lot of needs around accessible homes, like who does, we're a center for independent living, but we don't get very much money for our building ramps, grab bars, making sure homes are accessible. But we're always looking to see where we can get funding to help as just whoever we can. But again, what we're noticing is everybody's referring everybody to us. We're like, I don't know what they see us as. Maybe the people that will do everything for even the hospitals refer people to us. The hospital next door, all their public health nurses refer everybody to us. But what our center does mainly is a lot of education around independent living, how to stay safe, how to manage your medical conditions, disabling conditions, how to just manage that so they can continue to live in their own homes and in their own communities for as long as possible. But there's still a lot of need around how do we get monies to buy more durable medical equipment, because I was on the other session and we were talking about health, transportation and healthcare. And it just seems to us that everybody expects us to be the folks that give out durable medical equipment, when in reality, we're just a loaner program. But all those items, when you loan out durable medical equipment, a lot of them don't come back over time. So, and you're always needing more. But the questions on our mind is, where's the medical insurances that's supposed to buy these items? And so our that's what we're looking at. And like who's supposed to, where's the money to serve? There's a program out of Window Rock that specifically gets money to build ramps and make houses accessible. But they only serve up to age 80 for some reason. And nobody is serving from age 80 to 100 years old.
Oh, geez.
So we're like, who serves that? And so I asked them that. I said, why do you have this criteria that you only serve up to age 80 and not above? What happens to those folks? I don't know. There's an area on aging. They're supposed to help them. And I'm like, but do you know if they're on? No, I've never heard of them helping. So, and then we can refer them to Altex, but Altex is telling us nobody's eligible unless if they're bedbound. And we're like, okay, if we can't refer them to Altex, then who helps us? So there's that population from age 80 to 100 that are left out of services. So that's a continuing thing that I have to address with the previous Navajo Nation president. Just didn't care to listen to anybody. The new one hopefully will. So I get to meet with the Navajo Nation Disability Advisory Council, who actually they're the advisory council to the president. I think I'm meeting with them. They said the 11th, but they really haven't confirmed it. So they might move it back to where I can bring up all these issues. Like who's helping this group? Who's helping that group?
So what's your relationship with N-CATT? Because there's other groups that are helping.
N-CATT is out of Flagstaff. Yeah, there isn't, I don't hear very much from N-CATT.
I serve people from Tuba City. I know that.
Yeah, I know they're up there. I've heard them do certain presentations, but not really. I can talk to Carrie. I know Carrie's up there into the city and see what they offer.
They might have some great services that you can partner with them on.
Yeah.
Right. That's a great point. Well, and that's actually a really nice segue to the next section. What does this project look like for? Because I'm thinking about for your agency in particular, if we're doing this project really well, it means that you have other agencies providing the services that your clients need, that you don't have to provide all of the services yourself, that if we have a better network, then the network can step in to assist. And I think that could be really helpful. Thank you for being here. So this is what was discussed with the last breakout session. So from the perspective of the patients, that they'll have better access to rides and to healthcare. And so that will make them healthier and just, it will improve their well-being. From the point of view of a technology company, we had Vince here from Unite Us, and he was talking about how this could really help them to build up that network of the transportation partners, but then also to raise awareness about this work with providers. And he referred to it as practice transformation, and really that network building, that it helps them to achieve their goals. We also talked about how Tribal Affairs has a different system, and so we need to make sure that we're really working through that. And then from the transportation provider, the one big opportunity there is to be able to get reimbursed for their rides by partnering with the state. And a lot of conversation in the first plenary this morning about Z codes and how can we help more nonprofit agencies be able to access the reimbursement, because they're now using Z codes, and those Z codes are specific enough, granular enough to be able to validate that cost, to be able to support that cost. And then, of course, from the point of view from healthcare, being able to access care, particularly in those rural communities, and it's about improving the quality of life and well-being to address those social determinants of health. Is there anything that you'd add to that from the perspective of the patient, the transportation provider, medical provider, technology provider? Anything to add or nuance? And if not, that's okay too.
One thing we're talking about right now is just maybe educating the community themselves on the type of medical insurances they pick that can give them more items, rather than, because what seems to be happening a lot is IHS, if their benefits coordinator is who they see, they're signed up for IHS.
Okay.
And we've, from experience, IHS does not like to pay for anything.
Oh boy.
For them.
Okay.
And so we're thinking maybe if we educated all the community members that we talk to about who will work better for them, you know, so that's something we need to work on, is getting to know the providers in some ways, so we can show these the patients when they go sign up for, you know, open enrollment comes around, that they know which one will work better for them, which one includes glasses, hearing aids, dentures, and transportation, because those are the needs that are really, really lacking out there, the services that they really need, and we just can't find anybody to provide those items for them.
Yeah, and that's a really good point too, because the community perspective. So the community benefits from this by having better access to better information, so they can make more informed decisions. Excellent.
I worked with the Hopi tribe for a while, and one of the places that I spent time at is the clinic in Kaikot-Smovi, and I noticed that they give priority to the Hopis, and I even saw it in their waiting room. They would say, well, this person is a Hopi, so let's bring them in first and let the Navajo wait. And so I don't know if it was just an attitude of the staff or if it was really the way they operate. So is there anything that can be done about that in places like Kaikot-Smovi?
Probably just to educate the Navajo individuals that, you know, I don't know if they notice it, you know, if it's happening. It's just a file.
Yeah, it was pretty pronounced, and I thought, well, this isn't fair.
We looked at a grievance procedure recently for IHS, because I think they're IHS, or are they 638?
They're IHS.
Okay, yeah, because we're trying to, well, we got a referral to do, we have a contract with Tuba City Regional Health to do transportation of people going to dialysis treatments. And that's our fee-for-service, our main fee-for-service program. It gives about close to 100,000 a year. So that's like our main money maker right now. So we got another one from IHS, because what happens is for the folks that are eligible for Medicaid, they're referred back to Indian Health Services or 638 programs. And they're supposed to pay for the transportation for these folks to go to dialysis treatments. And IHS finally gave, well, actually, there was a issue with him. He moved from one area to another, and the 638 hospital says we can't serve him because he lives out of our area. He has to go to the IHS hospital. So he came in that way. And this is our first agreement with IHS to do transport, and but they haven't paid us. To this day, they haven't paid us. So we're fighting over it because of codes.
Yeah.
They said we didn't know our codes, but the 638 program didn't care, maybe they corrected their own codes, but the IHS will not correct their codes. They said, that's your, you guys learn what kind of correct codes to use. You're never gonna get paid for it until you do. So we're fighting over that. But in the meantime, the individual, we had to suspend service because we just couldn't continue to provide service when we were not getting any money to keep going with him. So now he's trying to work with them, but we had to give him all the information on IHS grievance procedures.
Right. So maybe if we have better coordination, then we can have better reimbursement models too.
Yeah.
That are, okay, excellent. No, thank you for that.
Probably better communication.
Yeah.
In a sort of way.
Well, it also sounds like it'd be great to host an event prior to open enrollment at the library.
Yeah.
A place where anybody could come and ask questions of the options. All the providers want to sign them up, so they're going to come. And to be able to schedule that in a space like the library would be very open and amicable for having that conversation and getting people signed up for the right insurance. Because you're right, it's a big decision, and people, you need all the information if you want to make an educated decision. So
absolutely,
it's a beautiful library there.
Yeah, that sounds good. All right, why don't we move on to the next section then? Let's see, that was, what does this project look like? So the next one will be what resources can be offered and by whom. And with this, it's important to think about resources pretty broadly. It doesn't have to be money or anything physical that changes hands necessarily. It could be expertise, it could be time, it could be influence, connections, anything like that. So this is what the last group had talked about, ranging from transportation and the 5310 program. Medicaid reimbursement is a big topic. Being able to work with the state agencies, because if we're working with state agencies, and maybe we can help to drive some really constructive systems level changes. Dial-a-ride volunteers, the family services centers, the local and tribal governments. And then had a good conversation too about how do we promote this work? Because it's one thing to develop it, to launch it, to refine it, but we need to let people know about it too. And so some conversations about how to get in front of more specific groups like the veterans, working with Solari, the federally qualified health centers, of course, the libraries again. So that's what the conversation ranged from in terms of the resources. Do you have anything to add to that? Anything that you want to make sure stays on our radar in terms of resources that could be brought to bear?
I think a really important network is the food banks.
Yes. Really good.
This is where people go do their grocery shopping. It's the best place to reach people about diabetes, about federal programs they might be qualified for. It's a good network.
Definitely. Absolutely.
I know
with the state. Go ahead.
Okay. I know for me, it's a connection, better communication with tribal leaders, presidents, basically all tribal leaders, community leaders, because what happens out there is they don't give you, it's not like you can do an RFP and you sell yourself through that RFP and they give you the fund. It doesn't work that way out there. Out there, you have to appeal to all the delegates, and you have to beg for the money, and you got to sell whatever it is you're trying to get money for. And they all get together, they talk about it, they hash it out. If somebody doesn't like you, you're out. So it's not getting money easy like that. It's really, really hard. So so a lot of it's relationship building, just working together really well with them. And really telling them why what is it you're gonna use the funding for?
Right, absolutely.
It's just that's what it is.
Okay.
With the, are you finished?
No, I'm done.
With the state agencies, it's important too to know where to start and which ones to go to. And I think the important ones are Arizona Department of Health Services, Department of Economic Security, and within that agency, Aging and Adult Administration.
Yes.
And then Governor's Council on Aging has a lot of influence, even though they don't have
Thank you. And
a great deal of money.
excellent. No, thank you. Those are all good.
I
yes.
guess that's another reason.
Governor's Council on Aging.
Thank you.
We were looking for services for an elderly gentleman that lives out in Tuba City, and he's not native. He's Hispanic. We just could not find services for him because a lot of the agencies, NACOG, some other programs have contacted. They said as long as he lives on the reservation, we can't touch him. So we were stuck.
Oh, no. Yikes.
So we had to find.
Just by not getting services from the Native Nation either.
No, they can't get, so he's out there. But we had, we were finally referred him to veterans, veterans program. We're hoping that works, because if it doesn't work, then we gotta go back to finding out what other referrals for him.
Yes, it's yeah, absolutely. Okay. Any other resources that could be brought to bear?
How about churches?
Oh, that would be good.
Because
Yes.
they usually have resources directly, food banks and plus they get people all the time that call them needing resources.
Yes.
Right, so.
Yes, absolutely. No, that's also a great resource for volunteers as well. Yeah, perfect. Okay, excellent. Thank you. All right, we can go to the next one, partners, roles, responsibilities, and contact information. We had a bit less on this one, so it'd be great if you have other ideas. So for the potential partners, I think that we have a lot of ideas for partners from the project duplication answer set from those Post-it notes. Are there additional partners, or can you help describe what the roles would be for transportation, medical providers, outreach and enrollment, navigation, other people that we should be talking to at this point?
I think schools.
Oh, schools would be good.
There's some places where if there is not a community library, there's a school library, and that's where
Right.
people go vote. who live there.
Oh, nice.
That's how it
Yes.
is in Arivaca. It's really interesting because
Right.
it's a great way to plan a community where there's a
Mm.
beautiful park next door to the school, and that's where the kids go exercise. You know, it really is an idea. It's the whole idea of efficiency in terms of being able to deliver services in a small community. In many communities, it starts in the school.
Excellent. Okay.
In Yavapai County, we have a county schools librarian. And she works for the county, not for the school districts, so she's able
interesting.
to go into any of the schools, charter schools, private, public.
Nice.
Offer her services. She helps to train, their staff and show them best practices. But as a result, she's been with us for about 3 years now. So she's built up a network of,
Nice.
the school community.
Yeah.
So it would be easy I wouldn't say easy, but it's an avenue for deploying information or,
Right.
or healthcare sort of
Yeah.
services that could be offered or coordinated through the schools. That'd be an easy.
Absolutely.
way to
So
do
the school
that.
library sent too. Excellent. No, it's a great resource. Thank you. Very good.
Area agencies on aging are another one.
Oh, yes, absolutely. Sam?
I'd also like to suggest any existing public transit, especially in these rural communities. I know that's a little bit more sporadic. And if anyone in these public transit agencies is interested in expanding to fill an existing need, I mean, I'm just assuming that they're catching some of the transportation, healthcare transportation need already.
No, that sounds perfect. Thank you. Definitely good partners in this. Excellent. Okay. We can go to the next section then. How do we pay for this? We talked a little bit about Z codes and being able to get reimbursement for providers. The last group raised the ideas of grants, fundraising, public donations, so more of a traditional approach. Also, there's the suggestion to look at different tax initiatives. They were citing First Things First as the example there. And of course, that's an early childhood effort. Is there something that could be broader and more focused on transportation and healthcare? Looking to state agencies to help partner with us as well. I'm seeing if there's anybody at a national basis. And that point about in-kind contributions, I think is really important because when we first started developing this project about a year ago, at least for me, I was really thinking of it in terms of that more traditional funding model where you write the grant, you apply for the grant, you get the grant money, and then you spend it and then figure out how to keep it going afterwards, which that works. But then thinking about resources and support more broadly, and it's not just about the cash, it's about the expertise and the in-kind contributions that different partners can contribute. As being really important to this, particularly on the technology side. We don't necessarily have to pay for a new platform. Let's take an existing platform and see if the company who owns that platform would be open to modifications of their system. It makes it more relevant. It broadens their use case. So they benefit, and then people that we're trying to serve benefit because then they have this enhanced service that maybe they didn't have before. Yes, Sam.
Well, if we're talking about in-kind,
yes.
One of the things I've been curious about for a long time now, which is underutilized in my opinion, is vehicle sharing between CBO and any other organizations that has vehicles. I realize there are a lot of complications around this with insurance, liability, all of that, but the amount of underutilized resources that are just kind of sitting around all the time boggles my mind.
Yes, no, totally agree. I think that's a really important point. MAG has staffed the 5310 process for a long time. It's tough to encourage that vehicle sharing. People will come in and they want all these vans because they need the vans, but then those same vans that they need are idle for a good portion of the time. It might only be a particular time of day, for example, when they need 10 vans, and then the rest of the time the vans are pretty idle. And then also, you see where it's the one person in the van and it's a 6 or 8 person van, and okay, well, can we bring that ride? So I agree. Sometimes it's service model, sometimes it's insurance, but there are barriers to that. But I think there's some real opportunity there too that's not been fully realized.
Partnering with agencies nationally. A big one is the National Highway Traffic Safety Administration.
Oh, okay.
And their job is highway safety, and so much of what they do is related to what we're talking about.
Oh, interesting.
They have a regional office in San Francisco, and that's our region.
Yeah.
And they would be good players to include.
I think that's a great idea. It's not one that I've worked with before.
I think another important thing to acknowledge and brainstorm around is the idea that grants are wonderful, and there are grants right now that pay for technology and telecommunications connectivity that never used to pay for those things. There aren't a lot of grants that pay for personnel.
Right.
So at some point, somebody needs to step up and do the work. And the reason our telemedicine program has grown into a program that still exists now 25 years later is I started out as 0.10 FTE as a donation from our department to support the telemedicine program. And as we moved forward, we would buy 0.25 of someone's FTE up into the city to be a telemedicine site coordinator, so that we in Tucson had someone we were paying to communicate with to use the technology. So those jobs grew into full-time jobs, but they were seeded with stakeholders who saw the value in the project and said, yes, I will give you 0.25 of Janet's time for the next year or 3 years or whatever it was. So that was really how we grew. Because in the end, it's work, right? I mean, we need the system, and it's about communication, but at some point, those stakeholders have to step up. Somebody has to be the person you're communicating with on both of those ends with doing this work for the patient. So to look at stakeholders, not only as grant partners and foundations as grant partners, but also thinking about how we can get the personnel to make this happen without a budget for personnel.
Right, right. It's an ongoing operational support that's so hard to find, but so critical. Yeah, absolutely. Good points. Other thoughts on this? In terms of paying? Other funding sources, other
Foundations are great. Not everybody thinks about foundations when you think about grants.
Virginia Piper, their focus is health.
Oh, yeah, she's great.
Sorry, could you repeat what?
Virginia Piper
Thank you.
Foundation.
And the Vitalist Foundation, they've been training digital health navigators to help with all of the transition in healthcare. They're all about health. They're a great partner. Marcus Johnson.
Excellent. And Piper Trust and Vitalist are both very good partners of ours.
And I would say all 3 state universities go Wildcats. But there's a College of Public Health at each of the universities. There are people who are doing great things on behalf of each of the 3 universities that includes teaching people about nutrition at the food bank. And so our 3 state universities, I think, are great resources that we should really maximize tapping into.
I think that's a very good idea. Wonderful. Okay. Anything else on this? Okay, we can move to the last question then. So where are we starting from? First steps, next steps. This is what we talked about. So we very much want to position day 3 in the most beneficial, helpful way. So if there's conversations that need to happen at day 3, then we want to set that agenda accordingly. If there are conversations that need to happen between this event and the next one, we want to be able to support those as well. We talked about the need to have a methodical approach to this, to really think through each of the steps and then be able to bring in the appropriate resources. Also, the need to possibly phase this approach. So we talked about having a demonstration phase and then a pilot project phase and then a full-scale launch phase to be able to learn incrementally, but to make the mistakes with as few people as possible, and then to learn from those and kind of build up from there. Also being able to identify meaningful roles within each entity's capacity. So how can we partner with you in the most effective way? The last comment was just do it, right? Learn from it and then improve. And then also to bring in those organizations that we've talked about so far, knowing that we haven't talked to anybody, to everybody yet who could be part of this space in a really good way. Are there additional steps or considerations that you want us to have in mind?
Oops, excuse me. I have a very general question, if you guys don't mind.
No, please.
Okay, earlier when we were talking about health plans and just the difficulty of getting some of the health plans to pay out, I don't know a lot about health plans personally. I'm curious if anyone here knows if health plans are at all incentivized to sort of reduce community-wide health costs or emergency department costs, and if so, or if not so, could we push some kind of incentive program for that?
That's a great question, and I think it varies from one provider to the next. If it's about, oh gosh, I'm trying to remember the phrase that was used this morning, values-based health insurance, or values-based healthcare, and they tend to be more community oriented and to engage more in social determinants of health than one maybe just purely profit driven, not to be crass in terms of their motivation, but that being said, I think all healthcare providers now are incentivized to not have people be readmitted to the hospital or to more expensive emergency procedures. And so I think at least on some level, even those that might be more profit driven, that they're still incentivized to keep people well. And then the ones that are more values based, I think they see nonprofit providers and community organizations as a more significant partner. But you're right. I mean, I do think it's really important to take a look at those incentives to make sure that healthcare is bringing the funds that they have to the table. And then to make sure that the community partners then can access those funds primarily, probably through a reimbursement model.
I want to make sure I was absolutely clear. I was speaking about the health insurance plans. Because when we were earlier talking about getting people onboarded with plans that will reimburse them, my concern as an agency that's, you know, basically receiving everyone's referrals is that, you know, if you do a good job, you end up becoming overwhelmed. And
Yes.
that's something that
Yes.
I'm thinking about with the health insurance plans as well. I want to make sure that we can somehow reward health insurance plans that are paying out for those health insurance trips.
Yes, definitely. Now, and it's interesting too to look at the different components of that, because you have to make sure that you have the right partner paying for something. There was an experience with a nonprofit who had this great partnership with the hospital, and the hospital would pay them to give rides to their patients. Well, they're so successful and people receiving such better care that they didn't need to go to the hospital anymore. So the hospital actually cut the funding for that program because they were no longer making money because people were healthier. So that's where it's really important to work with the health insurance companies and plans,
Right.
because they are incentivized. Their bottom line is improved if people aren't going in for that expensive emergency care. So really important point on that. And we need to make sure that we're bringing in the right people to pay for it, who would be incentivized by the same things that we are, you know, who are trying to achieve the same goals, which you'd hope hospitals were trying to achieve that same goal, but that works counter to their business model at times.
There was a similar situation with the prisons, and you know, we were in 9 prisons at one point, and we were saving the prison system of the state of Arizona all kinds of money in transportation. Well, the savings wasn't going to healthcare, it was going to the transportation section of the Department of Corrections. So the healthcare people were saying, we need more money to treat HIV. Well, where's all the money you're saving in transportation? Well, it all went to transportation.
Yeah.
So, you know, tracking the data piece is really important in terms of quantifying success. It's always measured in numbers. So
yes,
how to evaluate between the pilot phase and the next phase, and looking at that data and that criteria and all that information is going to be really critical to the success, and tracking the green is really important. Not a lot of people think about in terms of numbers of miles you didn't have to drive.
Yes.
But knowing how many miles you didn't have to drive for both the patient and the provider is incredible data.
Oh, absolutely. No, and that data piece I think is really important, because we need to put those data systems in place right away. Because then we can track the data, and then that provides more of kind of a pre-post assessment. But if we don't put it into place, and we are unable to conduct that assessment. So absolutely. 2 minutes. Okay, thanks. All right. Any other thoughts on that? So definitely first step, we need to make sure that we're collecting the right data, we're tracking the right data, and then we're using the data appropriately to make sure that we're driving towards appropriate outcomes. Excellent. Any other thoughts?
Since this is the first steps board right here, I'd recommend some people need to nominate ourselves to bring some data to our next meeting.
I love it, Sam. Thank you. I think that sounds perfect. Yes. So any volunteers, Sam?
I brought it up, so yeah, I'll nominate myself. We'll bring some Elaine data de-identified, but actually to the group, what specific data points would you be interested in having us bring?
Perfect question. Thank you. Yeah, I would imagine number of rides. I mean, to get a handle on kind of what that scale is. To know, and this is maybe more just qualitative than quantitative, but if you're reimbursed, you know, funding sources.
I can tell you offhand, last year in 2022 with about 2 drivers and vehicles all year, we accomplished more than 4,000 rides. And since January, with now 5 vehicles and drivers, we've been averaging about 650 to 700 rides per month.
Wow, that's incredible. Really great work.
Thank you.
Yes, but no, definitely. We need the work groups. Maybe next step would be to form a work group around this, and then to further the conversation. So excellent. Thank you for that. Any other volunteers? And if you know of other folks, please do let us know. Okay. So anything that we haven't talked about that you think would be important to address? Okay, excellent. Well, that brings us to the end of this session. We do have a plenary session starting. So I actually had us going on break at 2:10, but I was told that we had 2 minutes. So I'm wondering if they're going to start maybe a little bit earlier. So it might be good to be in this room around 2:10. If not by 2:10, then definitely by 2:20. And I want to thank all of you. I know this is a big commitment out of your day, particularly if you're driving on top of the time being here. So thank you very much for making the trip, spending the time with us. And we will circle back with you and with additional resources, next steps. But if you have any thoughts, questions, ideas in the meantime, please don't hesitate to reach out. I'd love to hear from you again.